6 exercises far better than walking for people over 60. Daily walking may be giving you a false sense of security. If you are over 60, you have certainly heard this classic advice from some doctor or friend. Walk every day, try to reach 10,000 steps. The truth is that walking does not activate the muscles that are falling asleep inside you at this very moment. Muscles that stay dormant too long become weak, then fragile, and eventually become the reason for a fall, a fracture, or the loss of your independence. Walking will not save you from that, but the right exercises will. That is why today you will see 6 simple exercises that will do far more for your body and your muscles than walking ever could. And since I know you might want to use the excuse that you do not like the gym, here is your answer. They are all done at home. No excuses, only results. Before we begin, please tell us in the comments your name and the city where you are watching our content from. We would love to know. Exercise number 1, wall push-up. The wall push-up is one of the most complete and safe pushing exercises for people over 60. It simultaneously strengthens the chest, the triceps, the anterior deltoid, and the scapular stabilizer muscles, which represents a far broader muscular effort than it appears at first glance. A weakened chest is not just an aesthetic issue, it compromises your ability to push your body upward during a fall, increases thoracic kyphosis, and compresses the rib cage, which can reduce breathing capacity by up to 15% according to a study published in the Journal of Physical Therapy Science in 2016. It is also worth noting that the chest muscle is responsible for much more than simple horizontal arm adduction. It participates in internal rotation and shoulder flexion, movements present in everyday tasks such as opening doors, pushing a shopping cart, or pushing yourself up when getting out of bed. To perform it correctly, place your palms on the wall at shoulder height, with your feet far enough from the wall so that your body forms a rigid diagonal line from heel to head. Before any movement, slightly retract your shoulder blades, as if trying to bring the tips of your shoulders closer together, as this protects the joints and improves chest muscle recruitment. Lower your chest toward the wall by bending your elbows in a controlled manner, without letting your head push forward or your hips sag. Exhale forcefully as you push back. A valuable tip: as you push, focus your attention on the sensation of squeezing an imaginary object between your chest muscles. This simple focus adjustment considerably increases muscle recruitment. You will know you are doing it correctly when you feel the contraction in the center of the chest, not just in the elbows or shoulders. The main errors to avoid are bending only the elbows without moving the torso, which eliminates almost all real muscular effort. Placing the hands too far above or below the shoulder line and letting the elbows flare excessively to the sides, which removes the workload from the chest and places unnecessary pressure on the tendons. Do 3 sets of 10 to 15 repetitions. As the exercise becomes easier, gradually move your feet farther from the wall to increase the angle and the load. The main contraindication is active shoulder pain or bursitis in an acute phase. In those cases, reduce the angle by moving your feet closer to the wall and progress gradually. Exercise number 2, seated knee extension. The seated knee extension is the most direct and safe exercise to strengthen the quadriceps, the large muscle at the front of the thigh, without exposing the hip and spine joints to impact. A weakened quadriceps is silently dangerous. It is the primary muscle responsible for decelerating the body when going downstairs, for absorbing the impact of a stumble before it becomes a fall, and for ensuring that you can stand up from a chair, a toilet, or a bed without needing support. The strength of the quadriceps in people over 60 is one of the main indicators of functional longevity studied by aging science. Those who keep this muscle group active tend to preserve their autonomy and quality of life for much longer. Can you imagine the impact that a single muscle group can have on your entire independence in daily life? The exercise also has a direct impact on the knees. A strong quadriceps compresses and stabilizes the kneecap correctly, reducing pressure on the joint and slowing the progression of osteoarthritis, one of the most common conditions in people over 60. To perform it, sit with your spine upright without leaning against the backrest, and extend one leg until it is parallel to the floor. Contract the quadriceps forcefully at that point, and hold the contraction for 3 full seconds before lowering slowly. The lowering phase should last at least 3 to 4 seconds, as this eccentric phase is what most stimulates muscle growth and strengthens the tendons around the knee. Alternate legs with each repetition. A tip that makes a difference. When you reach the top of the extension, slightly rotate your foot outward before contracting. This small adjustment increases recruitment of the medial portion of the quadriceps, the most important region for knee stability. The main errors to avoid are swinging the leg upward with momentum and without control, which completely removes the benefit of the exercise, and lowering too quickly, ignoring the eccentric phase that is precisely where much of the muscular stimulus occurs. Do 3 sets of 12 to 15 repetitions per leg. Anyone with a knee replacement or patellar chondromalacia should keep the extension only partial, without fully locking the knee at the top of the movement. Exercise number 3, Superman. The Superman is an extension exercise performed lying face down that strengthens in an integrated manner the spinal erectors, the gluteus, maximus, and the hamstrings. In other words, the complete posterior chain of the body. The spinal erectors are the muscles responsible for maintaining an upright posture throughout the day, and when they become weakened, the spine begins to progressively cave forward, resulting in hyperkyphosis, that exaggerated curve in the upper back that many people mistakenly associate with the inevitability of aging. It is not inevitable. It is the result of muscular weakness that can be reversed with consistent training. Chronic lower back pain frequently does not arise from overtraining, but from the lack of it, especially when it comes to the posterior chain. A study published in the Journal of Back and Musculoskeletal Rehabilitation demonstrated that older adults with strengthened lower back muscles showed a reduction of up to 42% in chronic lower back pain complaints after 8 weeks of supervised extension exercises. Another finding published in the Spine Journal indicates that weakness of the spinal erectors is directly associated with an increased risk of vertebral compression fractures, even without any external trauma. In other words, the spine can fracture simply because the surrounding muscles can no longer support the weight of the body itself. To perform it, lie face down with your arms extended in front of you. Inhale, and as you exhale, simultaneously lift your arms, your chest, and both legs off the floor as if you wanted to fly. Hold the position for 2 to 3 seconds and lower with control, without letting your limbs drop to the floor. An important tip: concentrate the contraction in the glutes and lower back during the time you are elevated. This considerably increases muscle recruitment and makes the exercise far more effective than simply holding the position passively. The main errors to avoid are lifting only the arms or only the legs without engaging the whole body, and letting the neck go into hyperextension during the movement, which compresses the cervical vertebrae. Keep your gaze directed toward the floor, not forward. Do 3 sets of 10 repetitions. The exercise is contraindicated for anyone with a herniated disc in an acute phase or severe lumbar stenosis. In those cases, consult a physical therapist before starting. Exercise number 4, high knee marching in place. High knee marching in place is a dynamic exercise that simultaneously works the hip flexors, the quadriceps, the lower abdominals, and the ankle stabilizer muscles, while also offering a light cardiovascular stimulus that is extremely valuable for people over 60. The hip flexors are deep muscles that connect the lumbar spine to the femur, and when they become weakened and shortened, something that happens quickly in people who spend a lot of time sitting, they pull the pelvis forward, accentuate the lumbar curve, and compress the spinal discs, causing chronic pain and completely altering the gait pattern. Anyone who has difficulty taking long strides, trips more easily, or feels pain in the front of the hip when climbing stairs likely has weak and shortened hip flexors. Before we continue, do not forget to subscribe to the channel and activate the notification bell. Having constant access to science-based information is what will help you progress with health in the long run in the world of exercise. Beyond the hip flexors, the simple act of balancing the body on one leg while the other rises requires intense coordination between the ankle, knee, hip, and core, which improves proprioception and considerably reduces the risk of falls in daily life. To perform it correctly, stand near a wall or chair for safety, keeping your spine upright and your gaze on the horizon. Lift one knee to hip height or as high as your mobility allows, and lower with control before lifting the other. The movement should be cadenced and rhythmic, like a slow military march. The main errors to avoid are leaning the torso backward to compensate for limited hip mobility, which negates the benefit of the exercise and can cause lower back pain, and looking down during the movement, which destabilizes your posture and reduces the balance benefit. If backward leaning occurs, reduce the knee height and progress gradually. gradually. Do 3 sets of 30 alternating steps or 60 seconds continuously. Anyone with a hip replacement should avoid lifting the knee above 90 degrees. Exercise number 5, lateral raise with improvised weights. The lateral raise with small water bottles or other improvised weights is the most effective exercise for isolating and strengthening the medial deltoid, the central portion of the shoulder muscle. This region is primarily responsible for the ability to lift your arms laterally to reach objects, hang laundry, comb your hair, place something on a shelf, or carry bags. A weak medial deltoid forces the neck and trapezius muscles to compensate for these tasks, generating chronic cervical tension and progressively limiting the range of motion in the shoulder. This limitation can evolve into what is known as frozen shoulder, a painful and debilitating condition that primarily affects people over 50 and that is far more difficult to treat than to prevent. The shoulders form one of the most complex joints in the body and require balance among all their portions. Many people unknowingly work the anterior deltoid in exercises like the wall push-up, but the medial and posterior deltoid are frequently neglected, creating imbalances that compromise joint health over time. A study published in the European Review of Aging and Physical Activity reinforces that the preservation of shoulder strength is directly associated with autonomy and perceived quality of life in people over 65. I have observed that practitioners who include this exercise in their routine report a significant improvement in the ease of performing household tasks that previously caused discomfort or pain. To perform it, sit or stand with a small bottle in each hand at your sides. Raise your arms laterally to shoulder height with your elbows slightly bent. Hold for 1 second at the top and lower over 3 seconds, controlling every inch of the descent. The main errors to avoid are using trunk momentum to swing the arms, which removes almost all effort from the deltoid, and raising the arms above the shoulder line, which compresses the supraspinatus tendon and increases the risk of rotator cuff injury. Do 3 sets of 12 repetitions. It is contraindicated in cases of acute rotator cuff injury or active shoulder tendonitis. Exercise number 6, glute bridge. The glute bridge is performed lying on your back with your knees bent and feet flat on the floor, raising the hips until the shoulders, hips, and knees form a straight line. It is one of the most complete and safe exercises for people over 60, as it simultaneously strengthens the gluteus maximus, the hamstrings, and the lumbar stabilizers without placing any compressive load on the spine. Here is a fact that tends to surprise most people. The gluteus maximus is the largest muscle in the human body. When it is weakened, the entire responsibility of stabilizing the pelvis is transferred to the lower back, which is one of the primary causes of chronic lower back pain in older adults. In addition, strong glutes are fundamental for stability while walking, for balance when climbing stairs, and for protecting the knees when decelerating on ramps and slopes. There is also a metabolic benefit that very few people know about. When the largest muscle in the body is active and well developed, the caloric expenditure at rest increases expressively. This phenomenon is known as excess post-exercise oxygen consumption, which is simply the body continuing to burn calories for hours after the workout in order to restore muscular balance. In other words, training the gluteus maximus means burning more calories even while you rest on the couch. To perform it correctly, inhale before rising and exhale forcefully as you lift your hips, contracting your glutes as if trying to squeeze your buttocks together. At the top, hold the contraction for 2 full seconds before slowly lowering, vertebra by vertebra, as if you were unrolling your spine back down to the floor. A bonus tip: during the contraction at the top, press your heels firmly against the floor. This increases recruitment of the hamstrings and amplifies the result throughout the entire posterior chain. The main errors to avoid are rising too quickly and lowering without control, which turns the exercise into a thrust and eliminates the muscular benefit, and lifting the hips so high that the lower back ends up arching excessively, compressing the spinal discs. Do 3 sets of 15 repetitions. There are no relevant contraindications, and it is even recommended in post-surgical hip rehabilitation. Anyone with a hip replacement should confirm the permitted range of motion with their doctor. And if you thought the list was over, we still have one bonus exercise that could not be left out. Bonus exercise: heel raise. All the exercises you have seen so far work muscle groups that support, stabilize, and move the body. But there's one muscle that does all of this and also takes care of your circulation at the same time, and that is systematically ignored by most people, the calf. The heel raise is performed standing, facing a chair or wall, rising onto the tips of your toes as high as possible, holding for 2 seconds at the top, and lowering slowly over 3 to 4 seconds until the heel fully touches the floor. It strengthens the gastrocnemius and the soleus, the two muscles that make up the calf, which are considered by specialists to be the second heart of the body. This is because they function as an active venous pump, contracting with each step to push blood accumulated in the legs back up to the heart against gravity. When this pump is weakened, blood pools in the ankles, causing swelling, a sensation of heaviness, varicose veins, and in more serious cases, deep vein thrombosis. If you have ever felt heavy legs at the end of the day, know that your muscles were asking for this exercise. Beyond its circulatory role, the heel raise strengthens the Achilles tendon, which progressively loses elasticity with age, and the plantar fascia, preventing plantar fasciitis, one of the most common complaints in people over 60. The calf is also composed predominantly of slow-twitch fibers, which means it responds better to longer sets of 15 to 20 repetitions rather than short and heavy sets. Another frequently overlooked benefit is the improvement of balance. The calf and the Achilles tendon are responsible for continuous small postural adjustments that keep the body stable while standing, especially on uneven surfaces, which directly reduces the risk of falls. Regular practitioners report a noticeable improvement in balance within the first few weeks of practice. The slow lowering phase is the most ignored and, at the same time, the most important part of the movement. It is what strengthens the eccentric fibers of the muscle, prevents nocturnal cramps, and improves the oxygenation of muscle tissue during rest. Think of the calf as a spring. It only becomes more resistant and elastic when it is stretched with control. The main errors to avoid are lowering too quickly, wasting the entire eccentric phase, and not rising high enough, which reduces the range of motion and the real stimulus on the muscle. Do 3 sets of 15 to 20 repetitions. The most relevant contraindication is Achilles tendonitis in an acute phase. In those cases, reduce the range of motion and prioritize the lower phase until full recovery. If you feel pain when trying to exercise at home, we have a video appearing on the screen right now showing you the best isometric exercises for you to do. They strengthen muscles without stressing the joints. Be sure to check it out. Thank you for watching until the end, and may God bless you, my friend.